is the mechanisms we have for healthcare provider compensation. For example, the traditional method, especially in the private health sector, has been fee for service. You walk into a facility, based on the inputs that are used in terms of providing care for you, a bill is generated and that's how you pay for it. At the other end of the scale, the extreme end, we have got a system which we call capitation, where we decide that there are a certain number of people we want you to take care of their healthcare needs. We decide on a certain amount, we provide it to you, and in that way the risk has been transferred to you. So that's a capitation system. In the recent past, we've also got a fixed fee for service system, which especially private health insurers have been trying to introduce, and which the private sector feels is very unfair in the sense that they're transferring the risk of taking care of the clients to providers. And a lot of the time without notifying the clients that that is what they're doing. So you're told, we'll pay you for every outpatient visit 2,500 shillings. The person who is coming for care has not been told that's the arrangement, but what happens is the tendency is people try to reduce the costs of care per individual, and therefore quality of care goes down. And that is something I think we should not encourage in our system. The other thing which determines the healthcare and where government has got a major role to play is what we refer to as social health determinants. There are certain things, for example, socioeconomic factors that have been known to be associated with poor health outcomes. For example, the level of education has a bearing on people's health status. What kind of jobs they have, what kind of income they have, the kind of environments they live in, and other health behaviors, for example, smoking, their sexual habits, alcohol use, and so on. So you'll find the truth of the matter is the determinants of health that are within the control of the individual are actually a very small percentage, between 30 and 40%. The rest you're actually relying on other people. For example, as an individual, you cannot change the healthcare system in which you go to seek healthcare. And that's why, for example, we have a big challenge, which I would also like to mention at this point, the issue of cross-border contracting of health services. A while ago, I sat on a task force where you could see